Welcome in, everybody, to another episode of the Strength for Your Purpose podcast. Back with you again here with another fantastic interview that I'm really excited to get to. I've got a good string of interviews coming up here, kind of getting back on that train. I love jumping on here and talking about things myself, but it's way more fun for me and probably way more fun for all of you out there listening, watching, however you take this in, to not just see and hear from me all the time. So I'm really excited to kick that off here again this week. I am joined by Dr. Alison Lee, who is the owner of Leeward Health in Portland and has some really cool stuff going on that I'm going to let her talk a lot more about here. But one of the coolest things that I, as a PT, am really excited about is a subscription model of direct care for sports medicine, which is just super cool to have as a resource for people in the greater Portland area, especially some of the folks that I work with that are just going to align so well with this. I'm really excited to talk about that. Dr. Lee, thank you so much for joining me.
Yeah, sure. Pleasure to be here. Thanks
Awesome.
for that
Well,
intro.
yeah, you got it. No, I'm really excited to dive into this a little bit more. Before we get into kind of what you have going on now, tell us
Sure.
a little bit about kind of who you are, what you do, and kind of your background a little bit in medicine and specifically in sports medicine.
Yeah, great. Thanks. Thanks so much. So I'm Dr. Lee, and my practice is Leeward Health and Wellness, and I've that's located in Portland, Maine. And as far as my background goes, I did a residency in primary care, so family medicine. So I went to medical school, osteopathic medical school, and actually did an extra year of medical school focusing on osteopathic manipulative therapy, which is a pretty big part of my practice now. So ended up doing 5 years of medical school and then a 3-year residency in family medicine. And I did all of that in the Philadelphia area and then landed in Portland, Maine, because I ended up deciding to do a sports medicine or non-surgical orthopedics fellowship at Maine Medical Center. And then, yeah, and then from there, I ended up working at OA Centers for Orthopedics, which is now Spectrum Orthopedics, and I was there for close to 5 years. And while I was there, I opened up the Ortho Access, which is the walk-in clinic there, the walk-in
Oh, yeah.
orthopedic clinic. Yeah. So that was my baby. I put a lot into that, and
Okay. I didn't know that. I love it.
Yep.
It's a
Yep.
great service. I tell people about it all the time. So
I'm so happy that it's still going, and I do think it's a great community service. Yeah, that makes me happy, and I sometimes send people there too.
yeah.
But yes, anyway, that sort of an innovative thing, and I really enjoyed putting that together, and saw a lot, just sort of a spectrum of no pun intended there. But
Yeah.
by the way, Spectrum Orthopedics, yeah, spectrum of musculoskeletal things that would walk or not walk, through the
Right.
door. Anyway, from there, I just decided that I kind of wanted to do my own thing, and like you, sort of, I assume like you're in the direct care world.
Mm.
Um, I got interested in that world. So kind of taking out the middleman just to simplify things and have more of that, the ability to provide personalized care and one-on-one care and take out all the stuff that kind of gets in the way of you wanting to do what you want to do, right? And
Absolutely.
all the stuff that doesn't actually contribute to patient care. Right.
100%.
So, right. But I'm sure you've had several, well, maybe a podcast about that.
Oh, for
Or
sure. Yeah, yeah.
yeah,
You're
right.
yeah. I mean, I've had this is probably the at least fourth time that I've had someone else in the direct access, direct care
Yeah.
model,
Yeah.
who's a physician. And then, if we go into other healthcare specialties, the number's even higher than that. But yeah, 100%. It's
Right.
no, I really like getting the word out there about providers like yourself because it does actually put an emphasis on healthcare.
Right. That's what it is. It's an emphasis on healthcare. Yeah. Right. Exactly.
Yeah. And it makes
And
so
a
much.
lot of us have the same story too, I think, about a
Mm,
lot of us were in sort of the traditional practice and saw the things that weren't really working, and really thought there's got to be a different way. There's got to be a better way to actually provide the care that I was trained to provide and want to provide. And so anyway,
Mm.
every time I talk to a practitioner in the direct healthcare space, we all have that same story.
Yeah,
Yeah.
100%. It's just becoming too common. And I mean, patients, consumers, I guess, of healthcare recognize all of it too. It's just I don't know
They
how
just
wide
don't know that something different is there. Yeah.
exactly. And then
Yeah.
sometimes I think they feel maybe it's more out of reach than it is, or and it's
Totally.
I like spreading the good word as it
Right, right, right,
about stuff
right.
like this. But in your kind of career trajectory, it makes even more sense to me that you were the, the driving force behind the ortho access service, because that is as direct care as an in-network place can get. Like, again, cutting out the need for the referral, and you know
Right.
why wait
It
the
was a
endless
gateway.
hours. Yeah,
Right.
why wait the endless hours in the emergency room when we could do all this stuff here, and you get directly to the orthopedic specialist who's going to line you up with all of that in one place. And I'm guessing that aligns a little bit, and this is something I'd love for you to elaborate on as well, with your sort of choice of being a DO and having that extra year of that hands-on osteopathic manipulative therapy. Because I just think that I've always sort of thought this, and would love to hear you talk about it more for people who aren't as familiar with it. But people in that space think a little bit more that way, and
Mm.
that's why they chose to get into medicine through
Mm-hmm.
that app.
Mm-hmm. Mm-hmm. No, when I decided I was going to go to medical school, I was interested in osteopathic medical school. And, I would say that some folks consider it more holistic, but I don't, I mean, you could argue that it is, yes. I mean, I guess I would argue that, yes, it is a more holistic form of medicine, um, because it takes into account like the physical body and the relationship between structure and function, and
Mm.
like at every level in the body that makes sense. Um, but anyway, yes, that is one of the reasons that I went to medical school, actually, is that I was interested in the musculoskeletal system.
Mm.
Um, yeah. And I decided I got, you have a couple days a week in medical school in your first couple of years where you're doing you're training and you're doing osteopathic manipulative therapy, this hands-on work. And I just got really just more and more interested in and wanted to really home in on that.
Mm.
Um, so yes, I mean, it's always been sort of like a foundational piece. And I think then like was a great foundation to launching me into the sports medicine and the orthopedic world as
Mm.
well.
Yeah,
Yeah.
absolutely. Absolutely. Yeah, no, and talk more a little bit too about your really what got you interested in that ortho world after you did some of your family medicine stuff. What is it that kind of made you passionate about going the,
Mm,
non-surgical
right.
ortho route with your career at that point?
Right. I mean, I think there are a couple things there. So one, I've always been really active. I was a competitive athlete. I played Division I soccer in college.
Mm.
And that's still, being active still remains super important to me.
Mm.
And then my kids play sports. And so, I mean, there's that part, right? And just seeing the real value in staying active and sports in general. And then in medical school, or I mean, sorry, in residency, you get really, really bogged down with, I say bogged down because, well, that's my opinion at least, with like hospital-based medicine um, and there's just so much. There's just so much to take in. Um, and there were, I think it's the number one issue that comes into a primary care family medicine office is musculoskeletal, right? But
Mhm.
you really get so little, you get so little training in it. because there's so many other things in primary care.
Right.
And so I definitely experienced that and wanted more. I wanted more. I wanted to be able to do more for my patients
Mm,
rather than referring them out.
mm,
Um, and so it was from there that I decided that I wanted to, that I discovered actually that I could do a sports medicine fellowship,
mm.
which really, and I often pair that with the term non-surgical or non-operative orthopedics, just almost to clarify, although I don't know if that's clarifying. Clarifying maybe you, but
Right, sure.
right.
You don't do the
But
cutting, you don't do the joint replacements.
right, just to
Yeah.
say that, right, that it's right. It's not about surgery. But my experience said working in orthopedics after my fellowship really highlighted this. Most of what comes into orthopedics is not surgical,
Mm,
at least not at first,
right.
right? And so I also saw a real gap there.
Absolutely. And that
Yeah.
makes total sense because there is a push in the field in general. I mean, I've even seen this. I've been a PT for just shy of 9 years now, and it I saw it maybe a little bit in school, depending on where I was maybe doing a clinical rotation. If there was a more
Hmm.
um maybe a newer ortho in the area.
Mm.
Not to say older orthos don't do this. I'm not trying to stereotype there or anything, but I
Well,
noticed
no, but surgery is what they're trained to do.
exactly. But
Right.
I noticed a trend starting that I think now is industry wide in the ortho world of let's be as conservative as humanly possible first and
Mm.
utilizing that even if we all believe that surgery is the end goal for this person, especially
Right.
like knee replacements, right? the
Right.
the big trend of prehab and
Right.
having
Right.
so many more people coming to my field in that avenue, but going to someone out of the gate that isn't the one that's going to be doing the surgery if surgery happens maybe helps the best conservative effort be the first foot that's put forward
Right.
when it's appropriate, obviously. And I think that helps drive us in more of a proactive model and
Mm.
less of a
Hmm.
reactive model, which
Hmm.
I just think from an orthopedic standpoint that's what we need, and that's from my bias of
Of
treating
course, right? Yeah.
conservatively all the time. But I see it so often and see it work so often for so many people that conservative management
Hmm.
and having that be the first step when it is definitely most appropriate.
Hmm.
It makes a lot of
Hmm.
sense because the field in general is going that way anyways. Even the surgeons are doing that. So
Oh, sure. I mean, you have to compare outcomes, and there are many things that, someone could have surgery for, but when you look at outcomes, a year or 5 years down the road, often there are not differences in outcomes between the surgical and the non-surgical
right.
route. And then you have to, I mean, you should really question whether surgery's, it's worth the risk and
Mm,
the post-operative rehab and the time off and all of that.
absolutely.
Right. Right. I mean, and I think, um, you know, I would say that one of the benefits of having someone like me around too is that I can take the time to explain, what um, well, it's almost just what we've carved out in the direct care space, right? To have more
Sure.
time and more comprehensive conversations. But I also think those of us in um, physicians trained in the non-operative orthopedic world are just we're more apt actually to have those comprehensive conversations,
Yeah.
right? About the pros and cons and what you could do maybe to just tide you over and buy some time because maybe it's winter time and that's not a good time for you to have your knee replacement. So
Right.
let's get you to September when you can plan ahead and
Mm,
um, yeah, just sort of those more comprehensive conversations.
mm,
Um, right. And then totally the preventative or the prehab part. Um, I completely agree. I tell my patients all the time, no matter what, it's it is to your benefit to go in optimized, to go into surgery being optimized, right? That's your musculoskeletal, with regards to your musculoskeletal system, but cardiovascular health, mental health, whatever it is.
Absolutely.
You'll have better outcomes. Your recovery will be better
Mm,
if you're going in good shape.
absolutely. No, yeah, no, you're preaching the choir here. I love
I
it.
know that.
Yeah, I love it.
I
Uh,
know that.
yeah, no, that's fantastic. So, tell us a little bit now that we have a good understanding of kind of how you approach things and how you see things. I think this is a great segue here to uh, starting up more of the subscription based model to
Mm,
the sports medicine side of things, because I know you already do that a little bit with primary care, but your
yep.
your heart and your purpose really falls in to the sports medicine side of things. That's what you're really passionate about. So talk to
Hmm.
me a little bit about the development of that and what you're looking to do with it and what you're providing to people with that service.
Right. So when I first opened up my practice, really actually I started with sports medicine and non-surgical orthopedics. That was my, it was my, that's where I was coming from, right? And so like my network of patients and referrals was sort of in that space. So I've been doing all along fee for service, so to speak. So folks see me and just pay as they go, pay as they, as the need arises. But what you're right in that what I realized, and I was also doing, and I have been doing direct primary care as well, and definitely really believe in the foundation of primary care that needs to be there for sure. But you're right, my heart is more in the sports medicine side of things, which I would consider, at least my approach, a really um, comprehensive. Um, well, I guess I'll back up. Let me rephrase that. My approach to sports medicine is comprehensive, right? And so it pulls in some of the primary care elements
Sure.
still. But, I'm just finding that I have the the patients are coming to me more than once, right? So the continuity either is there or could be there or should be there.
Mm.
Um, and um, there's um, I lost my train of thought, Phil.
That's okay.
Yeah, like
Yeah, people are coming more often.
yeah,
It makes sense because with your what I'm picking up from this, and correct me if I'm off base here, but with your background in again being comprehensive with the primary care, but having that passion for helping people stay active as they progress through the lifespan.
right.
You
Yeah,
talked about having the more comprehensive conversations with people that you already did when you weren't in the direct access model or the direct care model.
right.
Um, you're kind of playing quarterback for people a lot when it comes to their orthopedic health and wellness and the things they want to be doing. So it makes a lot of sense that if you're already seeing people over spread out over a longer period of time, that they would
Hmm.
have more access to you and you could be a part of their journey more long term, maybe with the
Right.
with what you have set up now.
Yeah, right. And I think I've been finding actually that that's really what people are gravitating to anyway, is that continuity,
Yeah.
right? So people really want to stay um, as healthy and active as long as possible, right? And so how can they do that? And so um, I've been finding that, the subscription model, I was already sort of doing that, I
Mm.
guess, because
Yeah.
um, I was approachable, and we'd have a really good visit, and then there'd be questions afterward, right? And I just questions, or shoot me an email, there'd be an email, or um something else that comes up, and I just sort of realized that, wow, like this is what I really like to do for patients. I don't
Mm.
mind answering this email, um and they were looking for it too. And so that continuity, the best platform really for that type of continuity is this subscription model, right?
Yeah,
where,
absolutely.
right, where you just, there's a flat monthly fee, and that covers everything, right? And so
Yeah.
there's no co-pays. People don't have to second guess whether they should schedule an appointment with me or not. No, you can just schedule an appointment. It's all included in the monthly fee. And I think a huge convenience is the communication I was just talking about. So like the ability for someone just to shoot me an email or a text message. Hey, I've got a question. Hey, I'm thinking about, I read something about this supplement, right? Or I read something about like this diet or intermittent fasting, or I'm thinking about starting this Pilates class or CrossFit or whatever it is, right? They can just, shoot me an email and say, hey, what's your, like, what do you think about this? And
Mm.
um, so I think, I'm sort of like it's a partnership, sort of a
Yeah.
thought partnership, right? And
It
the subscription model just lends itself to that,
yeah,
right?
it opens up that access,
Yeah.
the access whenever I need it for those lines of
Hmm.
communication, and the not
Right.
having to, worry about um what might be done in this visit, what might be done and how many visits. It opens up the ability of your services to be accessed however is most appropriate for that person in
Right.
your eyes, with the more frequent access to your help with stuff that it does not need an office visit, let's say.
Right.
Um,
That's often actually.
yeah, yeah, I think
Right.
that's
I mean, it's
yeah,
in the traditional world, it's so hard to get a hold of a provider or a practitioner, right? So often you have to schedule an appointment if you
yeah,
just have a question,
right,
right? And um, right, that's not the most effective, efficient way
yeah, yeah,
to get the
yeah.
care you need or a question answered.
For sure, you're right. I think that's what a lot of people are looking for. Actually, the conversation I had on the last episode with a recurring guest that I talk with frequently, we were talking about we have a world of information in our pocket. I mean, heck, on our wrists. We can ask our Apple
Yeah.
Watch, smartwatch, whatever we want.
Right.
It'll tell us something. It might not be what we want, but it'll tell us something. but but then being able to sift through all that and like make decisions, you still need an expert that can show you like, well, yes, that's true, but in this case, this, and
Right.
kind of guide you through that more clinical opinion based on the information you have at your fingertips. And I think to make that access as open as possible, and those communication lines as open and easy to access as they are, and
Yeah.
allow the provider to still give their value and get their value out of that model. I tell people all the time, the amount of value that is in these direct care
Right.
model, the subscription type services, is just immense. To just have all of the access that you wish you had, and if we're being honest, probably should have with all of your medical
I know. I know.
providers,
I
actually
know.
happening. And when you go see them, you have your hour, you have your time with that person. Um, it's really invaluable. In that.
I mean, I agree. Yeah, obviously we're preaching to the choirs here, but
Right,
I
right.
totally agree.
Yeah,
Right. I mean, and
yeah.
a lot of times people they don't even realize the value, right, until they've experienced it. Oh, wow. And I've had many patients just say, it's just really nice to know that you're there, right? That, maybe they've one time, had to send me a text message on a Thursday evening, like
Mm.
right now, right, about something, and I answered them. And that was enough for them to realize, oh, wow, that's really nice.
Yeah.
That's amazing. And I just feel more secure
Mm,
knowing that there's someone there, whether maybe they're only sending that message, once every 6 months, but
mm.
it's pretty valuable for them. Yeah.
Absolutely. Absolutely. Um, tell us also a little bit about, I know you also started some um uh an aesthetic part of your program. So tell us a little bit about that, and then I want you to tell people where they can find you.
Yeah, great. Yeah, I added an aesthetics component, which to me is just sort of like another facet to helping people achieve overall wellness and self-care. It's all about helping people to feel good about their skin, right? And take care of their skin. It's I, the skin is a huge organ system, right? And taking care of our skin is just like, we take care of every other organ. So,
Yeah.
right? So, anyway, I think it's kind of a cool addition, and there's a people are looking for this. I know that, there's a lot of medi spas, so to speak, in the area, and I just think that um, I can do things a little bit differently, right? As a physician, and
Mm,
um, talking to people about the pros and cons, and I'm not certainly not afraid to tell people when something a procedure may be indicated or not indicated, or maybe there's another place for them to go. But anyway, again, it's about having those comprehensive conversations about overall, wellness and what their goals are. And interesting to me, at least, is that I think it overlaps with some of what I do in the sports medicine world. So regenerative procedures and techniques. So, um, within my skill set, I do musculoskeletal ultrasounds and procedures for that, which, I mean, you probably know when that sort of thing is indicated, but, a lot of it is like chronic tendon injuries. So rotator cuff, for example, a really common one. I'm sure you see a ton of that.
yeah.
Um, Partial rotator cuff tear or tendinosis picture.
Mm,
Um, and anyway, I do some regenerative procedures. So something called tenotomy, where you take a needle and you basically needle the heck out of the tendon to try to stimulate a little bit of an inflammatory response to then capitalize on the healing process.
mm,
And then platelet-rich plasma is the one that most people know, and that's just another tool in the toolbox. But anyway, those things can be used in the skin as well. Those concepts and PRP specifically also can be
mm,
used. So it's kind of what got me interested in it.
mm,
I learned about something called radio frequency microneedling, and
yeah.
I offer that as one of the aesthetics procedures. But the idea behind that is that you use tiny, tiny needles to create these micro injuries and, underneath the skin. And then that stimulates an inflammatory process, which then stimulates the healing process. And included in the healing process is um, the production of collagen and
Mm,
elastin. And um, anyway, that helps to quote unquote heal the skin. So, or help the skin to remodel. So if someone's got acne scarring or scarring, any sort of scarring on the skin, this can help. It can help remodel that area and help
mm,
it smooth out the texture. Um, and then it's also used, I mean, classically, this procedure is used in the face and neck um, to um, restore the skin. So, we can't fight aging, right? The aging process is happening. And
sure.
one part of that is, our skin starts to change and gravity takes hold, and we develop skin maybe that's a little more lax, or some fine lines in there, and this kind of procedure can help with that,
Mm,
can help sort of, yeah, restore the skin. um, and then I'm also doing medical grade facials, which I like to say is sort of like with these two procedures. So I like to say the medical grade facials are sort of like going to the dentist for your like regular hygiene, right?
mm,
Just like your preventative visits, keeping your teeth nice and healthy. This is about keeping your skin nice and healthy.
mm,
And then the micro needling is a bigger thing, like getting braces,
mm.
right?
Okay. Yeah.
Right.
Good analogies.
Yep.
Yeah.
Yep. Yeah. So like, they both contribute to overall well-being and
Mm,
um, you know, helping you to feel better in your skin, literally.
absolutely. Oh, I
Yeah.
love it. No,
Yeah.
I love the blend of the skin health and even your sports med background
I
and
know. It's
blending
sort of
those things together.
interesting that
Yeah.
that's actually how they came together.
Yeah.
And I thought, wow, this makes sense to me, right? This is sort of like, you know, I want to encourage natural beauty, right? And this is a really actual natural way of doing it, right? You're just asking the body, you're stimulating the body
Yeah.
to do its own thing.
Absolutely.
Yeah.
Awesome. How can
Yeah.
people find you, Dr. Lee?
Yes. So they can go to my website. There's information there, Leeward Health, LEEWARD health.me. And so they can contact me directly through my website. There's a contact form. Happy to field emails. So Alee, ALEE at leewardhealth.me. I'm also on Instagram, Leeward Health and Wellness. And I guess there's the old-fashioned phone call too. So
Perfect.
207-618-6604.
Wonderful.
Yeah,
Awesome. Well, great. We will make sure we have all of that in the show notes as well. So if anyone
awesome.
wants to reach out and learn a little bit more about this incredible service and a little bit more about you and how you can help them with their health and wellness journey to stay as fit and moving as well as they possibly can, I would encourage everyone to go check that out. And thank you so much, Dr. Lee, for coming on and sharing your insights and your passion, and really appreciate it. And
Mm.
I just encourage everyone to go check this out, because I think this is going to be a really cool service for people who want to stay active throughout their whole lifespan.
Yeah, thanks so much. And I forgot to mention that you could do this through my website, but I'm happy to do a free virtual consult, and you can book that through the website too. Yeah, just,
Fantastic.
if anyone's interested in just learning more or learning what might be a good fit for them, I'm always happy to chat.
Yeah. Awesome.
Yeah,
Great. Well, thank you so much. Thanks everyone out there for watching, listening. However you took this in, I appreciate it. And we will see you back here next time on the next episode of the Strength for Your Purpose podcast.